Releasing Trauma is sponsored by the Global Association for Trauma Recovery. The Global Association for Trauma Recovery is a social impact organization serving as a resource for survivors and their families, dedicated to facilitating change by spreading trauma-related awareness and thus creating a more trauma-informed world. Learn more at gaftr.org. Welcome to Releasing Trauma, a Survivor's Podcast. I am your host, Tracy Osborne. I am a survivor of emotional bullying, rape, sexual assault, domestic abuse, and grief. After losing my husband in 2019, I set off on a new adventure to help other women release their trauma and create a life they can cherish. Each week, I will feature a guest expert or a survivor to share their stories, tips, wisdom, and more. The goal is so that you can take away even just the smallest nugget of information you can use in your life right now to make a change, and to remind you that you're not alone. There is life after trauma, and you can move from victim to thriver and create a life you can cherish. Hi, everybody. Welcome back to the show. I am your host, Tracy Osborne. With me today is Dr. Loren Martin, even. I can't talk today. We're going to be talking about the big thing that's happening in our world right now, the COVID, the pandemic, and all of the anxiety and trauma that it is causing everybody. This is a very huge topic, so I'm excited to dive in. So welcome to the show.
Thank you.
I always like to start out with having our guests tell us a little bit about their backstory. So why don't you share a little bit about you?
Sure. Yes. So I'm actually a trained neuroscientist. I have a PhD in neuroscience and also a psychologist. I've been in a department of psychology for the past 15 years at Azusa Pacific University. I am the director of research for the doctoral program in clinical psychology, and I serve as the chief science officer for Alter Health Group.
That's a lot. That's a lot. That's pretty impressive. Well, so today we're going to be talking about COVID, and now we've got this new Delta strain, and I've heard things about a Lambda strain coming out, and people are just anti-vax, anti-mask. Do we mask? Do we do this? And the world, I think, is in just complete turmoil over this whole pandemic, and it's causing just insane amounts of mental stress.
Yes.
On everybody.
Yes, for sure. Not just anecdotal either. There's certainly a lot of data that backs that up. The American Psychological Association has actually reported that nearly 70% of Americans are experiencing significantly increased stress as a result of the pandemic. And so there's certainly, we're seeing that in the rise of mental health disorders, as well as the rise of behavioral health problems.
I'm sure substance abuse has probably gone up, but also things like domestic abuse has probably risen.
Mm-hmm. Absolutely.
Child abuse, child neglect, and all of those things have climbed. Those numbers have climbed as we've been in lockdown and all of that.
Yeah, we're seeing, in fact, the U.S. Census Bureau does this household pulse survey, and it just provides a measure of a lot of different factors, including reports of anxiety and depression. And they've found a 400% increase from pre-pandemic levels based upon this survey. So really tells you that this is a problem that's impacting many. We're seeing the outcomes of that. You've mentioned some of those. The CDC recently reported a year over year, so from 2019 to 2020, a 30% increase in overdose deaths. So that you can see how this is hitting home for many people, not just the increased substance abuse, but then also this increase in overdose deaths.
I'm sure. And I think I would imagine, I don't know the data on it, but I would imagine suicide is up as well with all the isolation.
Yeah, so there are several reports that have been published on increases in suicidal ideation since the start of the pandemic, and especially in youth. And I think that's something that is, I mean, any kind of increase in suicidal ideation is obviously very concerning, but to see the numbers in our youth and recent reports indicating especially females that are in their teens that are reporting these increases in suicidal ideation.
I wonder what's causing that. I mean, aside from the typical peer pressure and society and all that stuff.
Yeah, and increased loneliness,
Yeah.
greater feelings of being disconnected. I think there's a lot of what we call learned helplessness out there, and in which people feel like they've lost a sense of control over their own situation. Yeah, there are a number of factors leading into this.
So, what is out there for people? What's out there for help? I mean, we're still basically stuck at home. Yes, the world is kind of, or the U.S. at least, is kind of opening up, but I think given this new rise of cases, we might end up getting shut down again. So, what help is out there for people?
Yeah, so I think that the good news is there is help. There's definitely help out there, and I would be remiss if I didn't mention the National Suicide Prevention Lifeline as a source of help, certainly for those experiencing suicidal ideation. And so I think it's important to consider the resources that are available, including this lifeline, which is 1-800-273-8255 for any of your listeners. But also for those who are just experiencing this increase in stress and increased anxiety and depression that is coupled with that, there are resources that are available. And the U.S. Federal Emergency Management Agency, or better known as FEMA, as many people probably are familiar with, they recognized at the very outset of the pandemic that there was going to be an increase in mental health concerns. And so they actually announced an initiative to fund states' efforts to provide crisis care for those struggling emotionally and mentally due to the COVID-19 pandemic. They announced this initially back in March of 2020. So it shows that this was known. This was going to cause an increase in emotional and mental concerns and needs. And so thankfully, in the state of California, calhope.org has actually been this initiative that Alter Health Group's been able to partner with. And we've actually established what's called the Be Well line. And recognizing that, many people out there need to be able to reach out and connect with someone for support and health during this time, and also recognizing that there's a limitation on how many actual licensed clinicians are available. So this is a peer support line. They're trained peers. They've gone through crises themselves. They've been trained in how to manage those crises, and they're able to provide the emotional support necessary through these virtual visits. And these visits are free. And I think that's the big thing. It's a free service. It's funded by FEMA. And people can actually call or go to the bewellline.com, or they can call the number, which is 855-838-6910. And they're able to connect with someone who can, be that initial point of connection for emotional and mental support. And they can, continue through the, this virtual care platform They're able to connect by phone, video conference, or computer chat for up to 6 visits for anyone in the state of California who's looking to connect with support and resources.
That's fantastic. I love that. And listeners, just, don't forget too, whether you're in California or outside of California, the Global Association for Trauma Recovery also has our support group too. So just head over to gaftr.org and you can join our discussion boards for free over there as well. So there's plenty of support out there for you. But aside from these free resources, what can we do to support our neighbors and our friends and all of these people who are they're hurting and they're scared?
Yeah. And that I think has been one of the toughest consequences of the, social isolation that we've seen as part of the pandemic. Is it's hard to know who's really hurting, right? Who's suffering. And yet, if you do know someone who, you've noticed a behavioral change, if you've noticed a change in attitude or emotional state, then here's a chance that you can intervene in some way by providing access to resources. Certainly, you can be that first point of contact as a friend or family member to reach out, to be bold and to oftentimes I think human nature is to kind of ignore it and yet
hope it goes away.
right exactly, and yet we need to overcome that boundary, right, to provide the support that's needed at this time. And we see it in impacting so many people, whether it's because they've lost loved ones due to the pandemic, or whether they've lost a job, or whether they've just experienced the social isolation, the lack of community, I think for many of our youth, they're struggling right now with the inability to really fulfill goals and achieve goals. Like things have been delayed in their life, and that's really difficult to deal with. Because they're things that are out of their own control, and so it leads to this growth and stress which then leads to the anxiety and depression, and unfortunately some of the behavioral outcomes that we see as a response to that, including the increased substance use throughout the pandemic.
I mean, this is a time where, as a nation, as the world, really, we need to come together. But what I'm seeing is we're being driven apart by the whole, mask, anti-mask, vaccine, anti-vax campaigns that you see out there, and people are fighting over it. Do you think that's, is it based out of fear, or, what is driving our society apart rather than pulling them together?
Yeah, it's a very complex question, right? There's a multitude of factors at play here, but certainly I think we have to look at some of the root causes. Politicization is obviously a problem, but that's always going to be there. I think when we recognize the increased stress and the increased anxiety, and then we can see that some and the increased loss of control. I think that's something that we can't overlook. Then people are grasping for some measure of control. I think that's what we're seeing, the expression of wanting to have freedoms, but maybe not recognizing how that impacts others potentially. There's a lot of it's very difficult situation. I think we can look at homicides, right, as a behavioral outcome of this. Based upon FBI statistics nationwide, we've seen a 25% increase in homicides. Now, there's a number of factors that go into it, but if you look at the root cause of the behavior, there's going to be the increased stress and anxiety associated with the pandemic.
I can see that. I mean, I know here in Atlanta, crime rates have just skyrocketed. It's crazy. And yeah, I think a lot of it is due to the pandemic, the stress and the anxiety, but also I think a lot of it is due to desperation.
Right. Yeah.
People they're desperate, like you said, they're out of control, or they have no control. They're losing jobs, and money's running out, and things like that. So, I think that could be a big factor why crime is on the rise.
Yeah, I think you're right. I think, there'll be a lot of studies, right, that come out of the pandemic, and a lot that are currently ongoing, right? And a lot of that's going to be trying to look at some of these root causes. But, there was a real interesting study published in the journal Pediatrics, which is from the American Academy of Pediatricians. Mm-hmm. And they actually found that, at least when it relates to suicide-related behaviors, they found that it was correlated with times when COVID-19 stressors and the corresponding community responses were at their highest. And so they were able to look, I believe it was in the greater Dallas areas where the researchers conducted this particular study. And they were able to actually see that there was this, increase in these suicide-related behaviors associated when there was this heightened response to COVID-19. And I think you mentioned, Delta, and we're seeing, this surge right now in cases. And and so, we're likely seeing this corresponding surge in, unfortunately, the mental health crisis that's associated with the pandemic. I think, it's something that has been consistent throughout the pandemic, but that also rises and falls as the COVID-19 stressors rise and fall with these various surges that are being experienced.
Yeah, I mean, we saw a ray of hope that things were kind of calming down. We're going to start returning to whatever this new normal is going to look like. And now all of a sudden, we're back up on that roller coaster, going back up again. With the new strains and all of that, and I'm just not sure people really know what to do at this point.
Yeah, I think what people should recognize is that there will be these cycles, just like we see with any other infectious disease that if you look at the influenza cycles, right, there's always these seasonal surges that take place. Unfortunately, with COVID-19, the outcomes for many people are much more severe than what we see with influenza, just because it's a more of a respiratory-based illness. And so I think that's where, when people are searching for any kinds of signs of hope or when, we're going to move forward, and we see that when the community responses are lessened, right? When the schools and businesses reopen, and when things like masks are no longer required. And so that does provide that hope. But then when we have to return to, really more draconic community responses, then it becomes very difficult for people to deal with, because that hope has been taken away. But I would just encourage people that, recognize that there is hope, that, these things do cycle, that we're going to be, I think before too long, moving into the post-Delta surge. And hopefully with that, we see these signs of hope as we move on. And then I think just looking historically is important as well, and recognizing that throughout history there have been pandemics of infectious disease, and that they do often last for a couple of years, and we're able to move beyond it. And I think especially as the science catches up with providing better treatments and even improvements in the vaccine. We're already seeing that with a recommendation for a third dose of the vaccine that seems to be already there for those who are immunocompromised. I think that's showing you the hope that is there before us, that's coming, that we can move into a post-pandemic world. And that's what I'm excited about in my role with Alter Health Group is, we're all about the science of transformation. We're all about evidence-based methodologies and really focused on, how we can treat the whole person, the physical, mental, emotional, social, spiritual, human connectedness is important to us, and why we're excited to be able to offer the free resource through the Be Well line.
Which I absolutely love. Well, thank you so much for coming on and talking with me about this today. This is, again, such a very important topic that, it's not something we can just sweep under the rug. We have to get it out there and talk about it.
Yes, absolutely. And thank you for bringing attention to this to your audience. I know that there are members in your audience that are hurting from this. And, I just want to provide them with encouragement and hope that there are resources available and that things will get better.
I agree. So thank you again. Listeners, as always, I will have Dr. Martin's contact information and everything that he discussed, the CalHOPE Initiative and the Be Well line. We'll put all of that information in his show notes. So just head over to releasingtraumapodcast.com, pull up his show, and all his contact information will be there. Thank you again, Dr. Martin, for joining us. And listeners, thank you as always for tuning in. We'll talk to you in the next show.
Hey, thank you.